Checking with Mary.
Okay, thank you so much, Russ. It is 9:01 now on Breakfast Television. Prime Minister Justin Trudeau says the Canada Emergency Response Benefit is being expanded. He says it will reach more Canadians, including seasonal workers.
We're announcing more help for more Canadians. This includes topping up the pay of essential workers. At the same time, we'll also be expanding the Canada Emergency Response Benefit to reach people who are earning some income, as well as for seasonal workers who are facing no jobs, and for those who've run out of EI recently.
And how to better protect seniors in care homes is a concern for everyone. Trudeau says federal and provincial governments are currently discussing how they can make that happen.
Today, across the country, the last members of this generation live in nursing homes and long-term care facilities. The uncomfortable and tragic truth is that the very places that care for our elderly are the most vulnerable to COVID-19. I will be addressing this with premiers tomorrow night.
And we know mental health is a major concern for many of us at this time. The federal government has launched a new online tool to help.
If you're feeling overwhelmed, know that you aren't alone, and there are people who can help. We have launched a mental health portal at canada.ca and through the Canada COVID-19 app, where you can go to find support. So if you need to, please reach out. We'll be there for each other.
It is 9:03 now. After 2 interest rate cuts in March, the Bank of Canada is not making another change for now. The central bank is holding its rate steady at 0.25% after bringing it down from 1.75% in reaction to COVID-19. The announcement comes one day after the International Monetary Fund predicted a more than 6% contraction of the Canadian economy. Looking at the numbers in BC now, 27 new cases of COVID-19 have been reported in BC. The total now over 1,500 in our province. 3 more people have died from the virus, all at long-term care facilities. 21 care homes have active outbreaks. Additional steps are being taken to address the outbreak at a Mission Correctional Institution, where 41 cases have been confirmed.
As part of that, the hospital, Abbotsford Regional Hospital, has developed a dedicated unit to ensure that people can be safely and securely cared for, if need be, in hospital. And in addition, Fraser Health is looking at redeploying the mobile medical unit that we have in the province that is able to look after people in a hospital setting and include critical care if need be.
134 people remain in hospital in BC, 58 in intensive care. Yesterday marked 4 years ago when BC declared the opioid crisis a public health emergency.
Many have lost loved ones, and particularly the challenge of that people have around stigma and around the concern about accessing help and getting the help that they need. I want you to know that you are not alone, that we are not slowing down our response or taking our focus off the importance of being able to support people who use drugs and their families and our communities.
According to the federal government, there were almost 15,000 opioid-related deaths across the country between 2016 and September of last year. Vancouver police say 40 people have been charged with breaking into businesses during the COVID-19 crisis. They claim most of the suspects are well known to them, with several offending again as soon as they're released. Even after dozens of arrests, the VPD warned it does not expect the rising B&E numbers to drop anytime soon.
We are seeing an increase in the downtown core of Vancouver, specifically along the retail routes of Granville Street and specifically Robson. We're also seeing this going outside of the downtown area. This is not only happening in downtown Vancouver. We are seeing it spill out into areas like Kitsilano and the other periphery communities. We are working with the BIAs in downtown Vancouver, and we are going to be reaching out as we see criminal trends going outside of the downtown core.
The VPD is recommending businesses take extra precautions, upgrade locks, add better lighting, and board up windows if possible. Well, as Justin Trudeau mentioned this morning, long-term care homes continue to be hardest hit by COVID-19. As the death tolls continue to rise at these homes, so does frustration with the system. Travis Prasad reports.
From a deadly outbreak in North Vancouver to more than 24 seniors dead at a nursing home in Ontario, long-term care facilities have been hit the hardest by COVID-19. And care workers advocates say once the pandemic is over, the approach to seniors' care can't go back to the way it was. South Granville Park Lodge on Vancouver's west side is the latest nursing home with an outbreak of COVID-19. By Tuesday afternoon, 4 staff members and 2 residents had tested positive for the virus. City News spoke to a woman who did not want to be shown on camera. Her husband works here in the maintenance department.
This scenario is my nightmare. I self-isolating for more than 30 days now, and the only way I could get this disease is his bringing at home.
Contracting the virus, an everyday reality for care workers on the front line.
This particular pandemic, particularly in long-term care, has highlighted the important work of caring for our elderly.
The BC Nurses Union president says the COVID-19 pandemic should be a turning point for long-term care in BC. For years, a lack of full-time hours has forced many caregivers to work at multiple care homes. But to curb the spread of COVID-19, BC's top doctor has temporarily restricted multi-site work. The Nurses Union wants the change made permanently.
So that a nurse can work in only one facility where they can hold a full-time or part-time position that meets enough hours for them.
BC also temporarily leveling wages among public and private care workers. A pricey move at $10 million per month, but one the federal government says could improve the quality of senior centers.
There are some that are run very, very well, and it is not universally terrible. But there are others that really struggle, and some of it is around the way that we pay people, and some of it is the way that we care for those facilities, and some of it is the way that we conceptualize aging.
Another problem exposed by the pandemic, a shortage of personal protective equipment at long-term care facilities. Many care workers are now running low on things like masks and gowns. Even if more complex issues like wages and workloads take a little longer to sort out, the Nurses Union says the province needs to immediately bolster PPE levels, even just to protect care workers from the next flu season. In Vancouver, Travis Prasad, City News.
Well, without urgent financial aid, TransLink says it's inching closer to bankruptcy and could face insolvency as early as June. As Greg Harper reports, the corporation wants emergency funding from the province and the feds.
Over the past 2 weeks, we have been engaged with both levels of government to share information about the challenges that we're facing and hoping to get partnerships with those levels of government to recognize the importance of public transit. So far, we have not been successful in obtaining those partnerships.
We are here to work together to find solutions, but those solutions aren't readily apparent. 275 million, I believe, was the number that Jonathan was using today. 200 million from Mr. Mayor Stewart, and I'm sure that Mayor McCallum and Mayor Harvey and every other mayor in BC has a number in their mind. Right. We need to see the depth of the problem before we can start to dig our way out.
Since the pandemic began, TransLink says it has reduced bus service by 15 to 20%. There are fewer SkyTrains being used. Plus, there's been a reduction in the number of West Coast Express trains and C-bus trips. But were these reductions enough? Could this situation have been avoided or at least prolonged?
Could they have done, for example, shields, like we're doing in lots of retails and banking now, we're doing shields. Could they have quickly come up with a solution to shield the bus driver from the people getting on and off the bus? Would that have been workable? That's a question where they may have been able to do it differently, but by the same token, it may have taken a considerable amount of time for that to be able to be worked out.
I think it's important to note that a transit system isn't like a light switch. It doesn't just turn off and turn on again immediately.
The Metro Vancouver Mayor's Council is holding an emergency meeting later this week to discuss potential options and cuts to service. Many jobs and how thousands of commuters rely to get around up in the air. In Coquitlam, Greg Harper, City News.
All right, it is 9:11 now on BT Vancouver. White Rock Beach will remain open since most people are following social distancing rules. Mayor Daryl Walker says while some are calling for the beach to be closed, it's up to the province, not the city, to make that call. He doesn't believe it needs to be closed as most people aren't gathering in groups. In recent weeks, the city had to close down the iconic White Rock Pier and Promenade because of large crowds. The roads may be quieter these days, but the rules still apply. That's the message from the Delta Police Traffic Unit. They tweeted this video after officers towed this golf cart off city streets. The driver, who was wearing a bathrobe and slippers, blew a fail. All right, as essential work continues throughout the pandemic, thermal cameras are being considered by companies. The device, often used by firefighters, could spot someone who may have symptoms of COVID-19. David Zura has the story.
A Vancouver area company says they've brought a new tool to Western Canada to fight the COVID-19 pandemic. Columbia Security Systems and Surveillance has introduced the thermographic body temperature measurement bullet camera. They say it's currently the most advanced camera of its type on the market.
The system has two sensors built into it. One is optical, one is thermal. So as soon as someone walks into the detection area within the picture, it will start detecting your face temperature, not anywhere in your body, just the face. And the system can detect up to 30 people at the same time and from 9 to 30 feet away from the system.
And it all happens in real time, meaning somebody watching out for an irregular body temperature can respond quickly before someone who might be sick disappears into a number of potentially crowded areas where essential work still takes place.
You'd expect to see it in high volume areas where you have access controls required. Convention centers, airports, hospitals, even say passengers going onto a ferry would be a great area to have a system like this.
The expectation is that this system would scan crowds faster than the conventional forehead scanners like the one you see here. It would also eliminate the risk to the person who would have to stand close to take the temperature.
Now, in the picture, it's showing that me and Ashley temperature is about 36.3.
But if John holds up a mug of hot water in front of his forehead, the system sounds an alarm and flags him while displaying the new, much hotter temperature. We could expect to see systems like this in operation in as little as 1 week. In Burnaby, David Zura, City News.
Very cool. Okay, thank you so much, David. It is 9:14 now. Federal ministers are expected to give another update in Ottawa, but first, new rules are now in effect for anyone coming back to Canada from abroad. Travelers must show acceptable self-isolation plans or be forced to stay at a quarantine facility like a hotel. They'll also be required to wear a mask or a face covering before heading to their final destination. Ottawa says tight travel restrictions along the Canada-U.S. border are likely to last for several more weeks. They've already been in place for almost a month with all non-essential travel banned. All right, it is 9:14. We're going to head over to Ottawa now. Let's listen in.